Dr. Frieden, as we look to countries around the world, Singapore stands out. They tried to reopen, and when they did, they saw a surge, specifically in crowded dormitories where migrant labor lives and works. When you hear those kind of numbers, does that give you concern about how we reopen?
I think anyone who is not afraid of the devastation this virus causes is not taking it seriously enough, and that can be a deadly error. Singapore has one of the best health and public health systems in the world, but this virus can exploit any weakness in a society, whether it's nursing homes that don't have good infection control in the U.S. or a large dormitory with migrant laborers in Singapore or elsewhere. This is a highly infectious virus. It's spreading like a super SARS, all of the way SARS spread and more. Here in New York City, we're experiencing just horrific devastation. Yesterday, New York City released the latest data on the number of deaths, and it's now approaching 15,000 in our city. To give you a sense of the horrifying scale of that, in the 1918-1919 pandemic, the worst public health disaster of the past century, there were an estimated 30,000 deaths in New York City over 2 flu seasons. In just 2 months, we've reached half of that tragic number, and the virus is still here. We have to work urgently to put it in a box through test, isolate, contact trace, and quarantine. If we do those 4 things, we can begin to reopen as soon and safely as possible. This is not a time to wait at home. It's a time to work. So we strengthen each of the corners of that box and get ready to reopen as soon and safely as possible.
Yesterday, Bill Gates said he doesn't believe we'll see a vaccine for another 12 to 18 months. If that's the case, until we do that, can the elderly go outside? Can you ride a New York subway? Can kids go back to school?
We don't know when a vaccine will come, but we do know that there are things that we can do now to get ready. And what we're going to need to see is a gradual loosening of the faucet, a stepwise return to not normal, but a new normal, where no one who's sick goes out, where we stop shaking hands for a while, where we cover our mouth and for a while wear face masks. There's a lot that we can do to reduce the risk, but people who are vulnerable, elderly, people with underlying conditions are going to have to shelter in place for longer. Maybe not that long, but longer.
But help me understand practically. If we do not have a vaccine, can I sit next to somebody in a movie theater? Can I go to a basketball game?
It depends whether the virus is spreading in your community. If it is, no basketball games, no way. But can you go out? Yes. Can you go out if you do it safely? Yes. But that means all of us have to work together. We have to make sure that people get tested when they're at risk, that people are isolated the moment they're infected, that we track all of the contacts who may have been exposed and quarantine them so they don't spread it to others. This is the way we can try to keep the virus at a simmer instead of boiling over.
Well, it's not a vaccine, but it is a treatment. Stat News reporting a new Gilead drug showing positive signs that patients are now making their way out of the hospital sooner. They're recovering. The stock market certainly likes these news. But how about from a health perspective?
There's one study that I've seen published. It's an industry-funded, non-controlled study. So we don't know whether this medicine will work.
Tell us what that means. Right? I'm a pedestrian. What is it? Tell me what that means.
So it means they looked at a bunch of patients treated, but they didn't compare them with anyone else who didn't get the drug. So you really don't know whether the treatment of those people was improved by the drug or just that they were being carefully washed and cared for and therefore got better. So unless we actually have a control or comparison group, we can't say for certain that this drug works. And that's important. What we are learning is that there are ways to more safely care for patients. It's becoming clear that providing oxygen in more ways can be very helpful. We're learning more literally every day about this virus. And the more we learn, the better we can care for people and the better we can protect the public.
How would you say we're doing right now in terms of how this country is handling it 2 weeks ago versus today?
We're sheltering in place to flatten the curve, and that's succeeding. But that's just the first step. We're beating a strategic retreat. Now we have to go on the offense. We have to attack the virus by testing strategically and widely, by aggressively isolating every single person who's infected, whether at home, nursing home, hospital, by tracing contacts. So we warn those who've been exposed so that if they get ill, they don't infect their family, loved one, and others, and by quarantining contacts so they stay separate for that 14-day period. Those four things can keep the virus in the box to get us out of our homes as soon and safely as possible.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.